A comparative study of healthcare system burdens in the USA, Japan, and Taiwan from managing CVD, CKD, and cancers linked to obesity and diabetes, using the viscoplastic energy model of the GH method. Math Physical Medicine. Number 1206, VMT Sharp 596, January 13, 2025. By Gerald C. Shu, EclaireMD Foundation. Category Public Health. Abstract. Key message. Among the three selected nations, USA, Japan and Taiwan, CVD imposes the greatest burden on healthcare systems, with total VMT energy values ranging from 3,987 to 12,716. In contrast, the burden of CKD and cancer on healthcare systems, their total VMT energy ranges from 115 to 339. This means the burden of CVD is approximately 35 to 38 times greater than that of CKD and cancer combined. Brief description. In the author's previous papers Nos. 1203, 1204, and 1205, he analyzed the burden on three national healthcare systems caused by three major mortality-related diseases: cardiovascular diseases CVD, chronic kidney diseases, CKD, and cancer linked to both obesity and diabetes over the period from 2010 to 2024. Each paper focused on one particular disease, and compared its respective impact across the three selected nations: the USA, Japan, and Taiwan. These studies created a matrix structure, examining each of these three diseases across three nations X dimension, by disease. In this particular paper number 1206, the author shifts his focus to analyze and compare the combined impact of these three diseases within each of these three respective nations Y dimension, by nation, offering a more holistic and comprehensive perspective. In addition to traditional statistical methods, the author employed the viscoplastic medicine theory VMT energy model to uncover hidden biophysical phenomena. For this series of public health studies, the author reviewed approximately a dozen published research papers to gain some additional insights needed to interpret his research findings. These VMT-based public health studies required exploring factors beyond pathology and physiology, including medical education system, professional training, equipment quality, work standards, insurance coverage, early detection through screening, clinic doctors' time spent per patient, and lifestyle changes across the three nations. The findings were initially analyzed using a qualitative scoring method, and subsequently verified through the VMT energy model. This VMT research method was designed to reveal hidden biophysical characteristics of complex medical conditions. This particular research method considers the following: 1. Time dependency. Variables evolve and change over time, making medical conditions dynamic and non-static. 2. Irreversible deformations. Most biomedical conditions studied by the author, except for certain short-term infections or minor injuries, scan it and do not return to their original state, especially in elderly patients. Chronic or progressive conditions, in particular, cause permanent damage or irreversible changes to the structure or function of the body or its organs. This phenomenon is commonly referred to as plasticity, or plastic behavior in physics and engineering. 3. Complex interactions. Dynamic systems involve multiple inputs and outputs, where M symptom outputs are interacted with N influential input factors M by N matrix, highlighting the intricate interdependencies present in biomedical scenarios. This integrative approach allowed for a deeper understanding of the factors contributing to noticeable disparities in healthcare systems and outcomes. In summary, average disease figures from 2010 to 2024, two influential inputs, for the United States, Japan, Taiwan are: obesity prevalence rate, 39%, 4%, 22%. Diabetes prevalence rate, 10%, 8%, 10%. There are three symptoms or output conditions. CVD prevalence rate, 2.745%, 1.493%, 0.974%. CKD prevalence rate, 0.321%, 0.395%, 0.359%. Cancer death rate mortality divided by incidence, 34.4%, 48.9%, 40.1%. The VMT energy contribution ratios of obesity and diabetes to three diseases in each nation are as follows. US, obesity 79%, diabetes 21%. Obesity is greater than diabetes. Japan JP, obesity 33%, diabetes 67%. Diabetes is greater than obesity. Taiwan TW, obesity 69%, diabetes 31%. Obesity is greater than diabetes. The total VMT energy levels of CVD for each nation are: United States 12,716 or 3.2, Japan 3,987 or 1.0, Taiwan 4,530 or 1.1. The total VMT energy levels of CKD for each nation are: United States 127 or 1.0, Japan 315 or 2.5, Taiwan 325 or 2.6. The total VMT energy levels of cancers for each nation are: United States 115 or 1.0, Japan 120 or 1.1, Taiwan 339 or 3.0. Then, the author reorganized his data by nation and obtained the following results of the total VMT energies, i.e. burdens on healthcare systems, listed by the order of CVD-CKD cancer for each nation. USA, 12,716 127 115, Japan, 3,987 315 120, Taiwan, 4,539 325 339. CVD imposes the highest burden on healthcare systems in the US, Japan, and Taiwan due to its high disease prevalence, long-term nature, widespread risk factors, and resource-intensive management. CKD and cancer, while significant, are less prevalent, 3 to 7 times less than CVD, and often more manageable with advancements in early detection and treatment. The relationship closeness or strength between these three mortality diseases, and the combination of obesity and diabetes can be summarized as follows. CVD with obesity and diabetes very strong. CKD with obesity and diabetes strong. Cancers with obesity and diabetes moderate to strong. A more detailed explanation of these relationships is provided in the biomedical information section of the main article. The most important conclusion is that the burden of CVD on healthcare systems is approximately 35 to 38 times greater than that of burden due to CKD and/or cancer.